We have 3 patients in category yellow. We have 1 black.
EMS is our flagship program in Eastern Africa, meaning emergency medical services. And this is something that was very much neglected in Africa. We have now, in the last 10, 20 years, we have seen a progress in road construction, and many people now drive cars, but there is no policy on the emergency medical services, so the ambulance services, but also in the hospitals, the ambulance departments, the first aid where people arrive when an ambulance brings in the patient from the road accident. There was no standard operation procedures how to deal with these emergency cases. We try now for Uganda and Kenya to build up national systems, strengthen the existing, bring them together, link them up, and force the system so that they can save people's lives from accidents on the roads, and also for other diseases in the villages to get them picked up from the villages up to the hospitals. It's often not possible for the people to afford own transport, and ambulances become very crucial for their lives if they're not transported in time. And also during the transport in the ambulances, they need to be already treated and they need to be observed and monitored and stabilized. Otherwise, very often that was the case in the past, when just the driver picked up the patient and did not do anything during the drive, then very often the people died during the transport. Actually, we started with training. So we trained a lot of people on high level, do the best for their survival and their medical care. So these trainings were the basis. But on top of that, we also for sure helped in the hospitals to improve the capacities and the infrastructure in the emergency departments. You need also people who can really operate these dispatch and call centers. Otherwise, maybe 2 or 3 ambulances would drive to the accident, and this is a waste of money and resources. And maybe the biggest success story is actually that we managed, both in Kenya and in Uganda, to work together with the ministries of health and other partners who are active in this field to develop a policy for emergency medical services in these 2 countries. So now they have official documents from the highest level, and that will break down all the duties of all the stakeholders in the country, what they shall do and what is to be done in the next future. We are rolling it out now from the capitals to the provincial level. So we looking for partners who are really willing and committed to do the same on the provincial level. So we have the commitment that we really want to have this change for the 2 countries, and maybe later on, if this is successful, we go also beyond the 2 countries to other countries as well.